Oh yeah, you can. Yep. All right. Let's talk about Haldol. Haldol is what type of medication? What's Haldol for? Nope. You're thinking of LOL. Yeah, you're thinking of LOL. Haldol. Haldol is a first-generation antipsychotic, right?
Okay.
Yep. Antipsychotic, and it's used for schizophrenia. What type of side effects does Haldol have? Well, when you think about it, think about your antipsychotics. Group them up. You know that antipsychotics all have this one particular effect. What would that be? Starts with an E. Extra. You're right. You're on the right track.
Oh my
Extra.
God. I kept extra.
Pyramidal effects, right? Yep. Antipsychotics have extrapyramidal effects. You also have anticholinergic effects. Dry mouth, blurred vision, constipation, everything dry, right? Drowsiness. It also causes immunosuppression, agranulocytosis. Haldol overdose causes this. What is it? Haldol overdose causes what? Neuroleptic malignant syndrome. NMS. Neuroleptic.
NMS?
Yep, NMS. Neuroleptic malignant syndrome. Okay, this is a potentially fatal disease. Causes hyperpyrexia. I'm talking a fever of like 105, 108. And it also has the same signs of EPS, but the difference is the temp, so you want to monitor temperature. Geodon. Geodon. Geodon.
Is that the brand name or the?
That is the brand name. The generic name is ziprasidone. That's with a Z. Ziprasidon. Ziprasidone has a black box warning. Why? What does it cause? It's contraindicated with people with heart conditions because it causes cardiac arrest. It causes you to have a prolonged QT interval, which can cause cardiac arrest. So we don't give Geodon to people that have heart conditions. Zoloft. Zoloft. Sertraline, right? Sertraline. What's the contraindication with Zoloft? You have to lower all of the other drug doses because it causes a toxicity with other medications. So like Coumadin. Zoloft and Coumadin, you have to lower the Coumadin dose.
Isn't that a depression medication?
Yep. It's an antidepressant. What type of antidepressant is Zoloft?
For anxiety?
No, that's a benzo. You're thinking about benzos. We're talking about antidepressant. What type of antidepressant? Selective serotonin reuptake inhibitor, SSRI. Right? Let's talk about tocolytics. What's a tocolytic? Miss Allen, what's a tocolytic?
Oh.
A tocolytic stops labor, right? Give me an example of a tocolytic. Come to class, Miss Allen. Give me an example of a tocolytic. Mag sulfate. Mag sulfate. Magnesium, MAG.
Oh.
Terbutaline. Terbutaline starts with a T, so that means it causes maternal tachycardia. Terbutaline. Mag sulfate causes hypermagnesemia. So all of these symptoms of increased mag level, you can relate it to mag sulfate when you're giving it to the OB patient. What do you want to monitor when you're giving mag? What else? You said heart rate, right? Blood pressure, reflexes, respiratory rate, and level of consciousness, right? Because they all do what? With hypermagnesemia. Nope. Go down. Stops it. Stops it. Goes down. Oxytoxics. What do oxytoxics do? We already talked about tocolytics. Oxytoxics do what? Start, stimulate, oxytocin, pitocin, methogen. Methogen causes what? Causes a high BP, right? What does pitocin cause? Causes uterine hyperstimulation. What are your fetal lung maturity meds? We talked about that a couple times. Medications for fetal lung maturity. What do we give them? It's a synthetic surfactant, right? Betamethasone. Betamethasone, right? Who gets it, mom or the baby? Mom. It's given IM. What did I say about steroids? Anything with the O-N-E is a steroid, right? Hydrocortisone, prednisone, betamethasone. What about Cervanta? Cervanta is another fetal non-maturing med. Who is that given to? That's given to the baby. What route? Transtracheal. Blown right into the trachea. It's given to the baby after the baby's born. Going back to psych. Give me an example of a tricyclic antidepressant. Tricyclic antidepressant. Elavil. Desiril. These are your NSSRIs. Causing anticholinergic effects, right? And they can cause euphoria. Way too happy. Extreme happiness. Benzodiazepines. Baby tranquilizers.
Baby tranquilizer.
Mm-hmm. Benzos. What are your benzos? Xanax. Right? Ativan. Clonazepam or Klonopin. Tell me about MAOIs. Parnate, right? Nardil, Marplan, AR, right? MAOIs are contraindicated with everything, and they cause hypertensive crisis. That's why we avoid those. But if that's your only route, once you've maxed out all your psych drugs. What about lithium? Tell me about lithium and sodium. They have a relationship. Low sodium makes what? High lithium. High sodium, it won't work. So you need to keep the levels balanced, right? Toxic effects of lithium. What are the side effects? Tremors, metal taste, severe diarrhea, hold the medicine, call the doctor. Here's the thing about lithium. It's the only psych med that does not mess with neurotransmitters. So it's safe to say that lithium does not treat depression. It treats mania. Make sense?